Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. With out the way, let's get started.
The client asks the nurse, "They say I have cancer. How can they tell if I have Hodgkin's disease from a biopsy?" The nurse's answer is based on which scientific rationale? 1. Biopsies are nuclear medicine scans that can detect cancer. 2. A biopsy is a laboratory test that detects cancer cells. 3. It determines which kind of cancer the client has. 4. The HCP takes a small piece out of the tumor and looks at the cells. The correct answer is 4. The HCP takes a small piece out of the tumor and looks at the cells. A biopsy is the removal of cells from a mass and examination of the tissue under a microscope to determine if the cells are cancerous. Reed-Sternberg cells are diagnostic for Hodgkin's disease. If these cells are not found in the biopsy, the HCP can rebiopsy to make sure the specimen provided the needed sample, or, depending on involvement of the tissue, diagnose a non-Hodgkin's lymphoma. Biopsies are surgical procedures requiring needle aspiration or excision of the area. They are not nuclear medicine scans. The biopsy specimen is sent to the pathology laboratory for the pathologist to determine the type of cell. Laboratory test refers to tests of body fluids performed by a laboratory technician. A biopsy is used to determine if the client has cancer, and if so, what kind. However, this response does not answer the client's question. Option 1 can be eliminated if you know what the word biopsy means. Option 3 does not answer the question and can be eliminated for this reason. The nurse is caring for a client diagnosed with acute myeloid leukemia. Which assessment data warrant immediate intervention? 1. Temperature 99.0 degrees Fahrenheit, pulse 102, respirations 22, and blood pressure 132/68. 2. Hyperplasia of the gums. 3. Weakness and fatigue. 4. Pain in the left upper quadrant. The correct answer is 4. Pain in the left upper quadrant. Pain is expected, but it is a priority, and pain control measures should be implemented. The vital signs in option 1 are not alarming. The vital signs are slightly elevated and indicate monitoring at intervals, but they do not indicate an immediate need. Hyperplasia of the gums is a symptom of myeloid leukemia, but it is not an emergency. Weakness and fatigue are symptoms of the disease and are expected. If all the answer options contain expected events, you must decide which is priority, and pain is a priority need. The charge nurse and the licensed practical nurse are caring for clients on an oncology floor. Which client should not be assigned to the LPN? 1. The client newly diagnosed with chronic lymphocytic leukemia. 2. The client who is 4 hours post-procedure bone marrow biopsy. 3. The client who received 2 units of PRBCs on the previous shift. 4. The client who is receiving multiple intravenous piggyback medications. The correct answer is 1. The client newly diagnosed with chronic lymphocytic leukemia. The newly diagnosed client will need to be taught about the disease and about treatment options. The charge nurse cannot delegate teaching to an LPN. For option 2, this client is post-procedure and could be cared for by the LPN. For option 3, this client has already received the blood products. This client requires routine monitoring, which the LPN could perform. For option 4, the LPN can administer antibiotic medications. The laboratory results for a male client diagnosed with leukemia include RBC count 2.1 times 10 to the power of 6 cubic millimeter, WBC count 150 times 10 to the power of 3 cubic millimeter, platelets 22 times 10 to the power of 3 cubic millimeter, potassium 3.8 milliequivalents per liter, and sodium 139 milliequivalents per liter. Based on these results, which intervention should the nurse teach the client? 1. Encourage the client to eat foods high in iron. 2. Instruct the client to use an electric razor when shaving. 3. Discuss the importance of limiting sodium in the diet. 4. Instruct the family to limit visits to once a week. The correct answer is 2. Instruct the client to use an electric razor when shaving. The platelet count of 22 times 10 to the power of 3 cubic millimeter indicates a platelet count of 22,000. The definition of thrombocytopenia is a count less than 100,000. This client is at risk for bleeding. Bleeding precautions include decreasing the risk by using soft bristle toothbrushes and electric razors and holding all venipuncture sites for a minimum of 5 minutes. The anemia that occurs in leukemia is not related to iron deficiency, and eating foods high in iron will not help. The sodium level is within normal limits. The client is encouraged to eat whatever he or she wants to eat unless some other disease process limits food choices. The client is at risk for infection, but unless the family or significant others are ill, they should be encouraged to visit whenever possible. You could eliminate option 3 on the basis of a normal laboratory value. The RBC, WBC, and platelet values are all not in normal range. The correct answer option must address one of these values. The client diagnosed with leukemia is being admitted for an induction course of chemotherapy. Which laboratory values indicate a diagnosis of leukemia? 1. A left shift in the white blood cell count differential. 2. A large number of WBCs that decreases after the administration of antibiotics. 3. An abnormally low hemoglobin and hematocrit level. 4. Red blood cells that are larger than normal. The correct answer is 1. A left shift in the white blood cell count differential. A left shift indicates immature white blood cells are being produced and released into the circulating blood volume. This should be investigated for the malignant process of leukemia. Leukocytosis is normal in the presence of an infection, but it should decrease as the infection clears. A low hemoglobin and hematocrit level indicates anemia and can be caused by a number of factors. Anemia does occur in leukemia, but it is not diagnostic for leukemia. Red blood cells larger than normal occur in macrocytic anemias. They are not characteristic of leukemia. You should recognize elevated WBCs resolve with antibiotics as an infection. Option 3 is not specific enough to be the correct answer. The client diagnosed with leukemia is scheduled for bone marrow transplantation. Which interventions should be implemented to prepare the client for this procedure? Select all that apply. 1. Administer high-dose chemotherapy. 2. Teach the client about autologous transfusions. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. 5. Provide central line care per protocol. The correct answers are 1. Administer high-dose chemotherapy. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. And 5. Provide central line care per protocol. All of the bone marrow cells must be destroyed prior to implanting the healthy bone marrow. High-dose chemotherapy and full-body irradiation therapy are used to accomplish this. The best bone marrow donor comes from an identical twin. Next best comes from a sibling who matches. The most complications occur from a matched unrelated donor. The client's body recognizes the marrow as foreign and tries to reject it, resulting in graft versus host disease. The CBC must be monitored daily to assess for infections, anemia, and thrombocytopenia. Clients will have at least one multiple line central venous access. These clients are seriously ill and require multiple transfusions and antibiotics. Autologous transfusions are infusions from the client himself or herself. This client has cancer involving blood tissue. To reinfuse the client's own tissues would be to purposefully give the client cancer cells. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? 1. Fever and infections. 2. Nausea and vomiting. 3. Excessive energy and high platelet counts. 4. Cervical lymph node enlargement and positive acid-fast bacillus. The correct answer is 1. Fever and infections. Fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid-fast bacillus is diagnostic for tuberculosis. Option 3 could be eliminated right off the bat because of the excessive energy. Illness normally drains energy reserves. It does not increase them. A child who has reddened eyes with no discharge, red, swollen, and peeling palms and soles of the feet, dry, cracked lips, and a strawberry tongue most likely has blank. The correct answer is 1. Kawasaki disease. Classic signs of Kawasaki disease include red eyes with no discharge, dry, cracked lips, strawberry tongue, and red, swollen, and peeling palms and soles of the feet. Incidence of Kawasaki disease is higher in males. The strongest indicator for this disease is the hallmark strawberry tongue. While assessing a newborn with respiratory distress, the nurse auscultates a machine-like heart murmur. Other findings are a wide pulse pressure, periods of apnea, increased PaCO2, and decreased PO2. The nurse suspects that the newborn has 1. Pulmonary hypertension, 2. Patent ductus arteriosus, 3. Ventricular septal defect, 4. Bronchopulmonary dysplasia. The correct answer is 2. Patent ductus arteriosus. The main identifier is the machine-like murmur, which is the hallmark of a patent ductus arteriosus. Pulmonary hypertension is a pulmonary condition which does not create a heart murmur. A ventricular septal defect does not produce a machine-like murmur. Bronchopulmonary dysplasia is a pulmonary condition which does not create a heart murmur. For the child with hypoplastic left heart syndrome, which drug may be given to allow the patent ductus arteriosus to remain open until surgery? Blank. The correct answer is prostaglandin E. Prostaglandin E maintains ductal patency to promote blood flow until the Norwood procedure is begun. Consider the opposite of wanting to close the patent ductus arteriosus. Which interventions decrease cardiac demands in an infant with congestive heart failure? Select all that apply. 1. Allow parents to hold and rock their child. 2. Feed only when the infant is crying. 3. Keep the child uncovered to promote low body temperature. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. 7. Organize nursing activities. The correct answers are 1. Allow parents to hold and rock their child. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. And 7. Organize nursing activities. Rocking by the parents will comfort the infant and decrease demands. Frequent position changes will decrease the risk for infection by avoiding immobility with its potential for skin breakdown. An infant sucking the fists could indicate hunger. Change bed linens only when necessary to avoid disturbing the child. Organize nursing activities to avoid disturbing the child. The infant would not be fed when crying because crying increases cardiac demands. The infant might choke if the nipple is placed in the mouth and the child inhales when trying to swallow. Keep the child normothermic to reduce metabolic demands. Which finding might delay a cardiac catheterization procedure on a 1-year-old? 1. 30th percentile for weight. 2. Severe diaper rash. 3. Allergy to soy. 4. Oxygen saturation of 91% on room air. The correct answer is 2. Severe diaper rash. A child with severe diaper rash has potential for infection if the interventionist makes the standard groin approach. Option 1 and 4 may be a reason the child needs catheterization. Shellfish, not soy, is an allergy concern. What should the nurse assess prior to administering digoxin? 1. Sclera. 2. Apical pulse rate. 3. Cough. 4. Liver function test. The correct answer is 2. Apical pulse rate. The apical pulse rate is assessed because digoxin decreases the heart rate. If the heart rate is less than 60 beats per minute, digoxin should not be administered. The sclera has nothing to do with congestive heart failure. Cough would not be assessed before administration. It is more commonly seen in patients who have been prescribed ACE inhibitors. Liver function tests are not assessed before digoxin is administered. Digoxin can lower the heart rate and cause dysrhythmias. Tetralogy of Fallot involves which defects? Select all that apply. 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 3. Left ventricular hypertrophy. 4. Pulmonic stenosis. 5. Pulmonic atresia. 6. Overriding aorta. 7. Patent ductus arteriosus. The correct answers are 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 4. Pulmonic stenosis. And 6. Overriding aorta. Tetralogy of Fallot is a congenital defect with a ventricular septal defect, right ventricular hypertrophy, pulmonary valve stenosis, and overriding aorta. Pulmonary stenosis causes decreased pulmonary flow. What can an electrocardiogram detect? Select all that apply. 1. Ischemia. 2. Injury. 3. Cardiac output. 4. Dysrhythmias. 5. Systemic vascular resistance. 6. Occlusion pressure. 7. Conduction delay. The correct answers are 1. Ischemia. 2. Injury. 4. Dysrhythmias. 7. Conduction delay. An electrocardiogram can indicate ischemia of the heart muscle. An electrocardiogram can indicate injury to the heart muscle. An electrocardiogram can show dysrhythmias. An electrocardiogram does show conduction delays. An electrocardiogram does not indicate cardiac output. An electrocardiogram does not show systemic vascular resistance. An electrocardiogram does not show occlusion pressures. The electrocardiogram checks the electrical system of the heart, not the mechanical system. Cardiac output is mechanical. Occlusion pressure does not have to do with the electrocardiogram, and systemic vascular resistance measures pressures in the peripheral system. The nurse is admitting a client with a diagnosis of rule-out Hodgkin's lymphoma. Which assessment data support this diagnosis? 1. Night sweats and fever without chills. 2. Edematous lymph nodes in the groin. 3. Malaise and complaints of an upset stomach. 4. Pain in the neck area after a fatty meal. The correct answer is 1. Night sweats and fever without chills. Clients with Hodgkin's disease experience drenching diaphoresis, especially at night, fever without chills, and unintentional weight loss. Early-stage disease is indicated by a painless enlargement of a lymph node on one side of the neck. Pruritus is also a common symptom. Malaise and stomach complaints are not associated with Hodgkin's disease. Pain in the neck area at the site of the cancer occurs in some clients after the ingestion of alcohol. The cause for this is unknown. The client diagnosed with non-Hodgkin's lymphoma is scheduled for a lymphangiogram. Which information should the nurse teach? 1. The scan will identify any malignancy in the vascular system. 2. Radiopaque dye will be injected between the toes. 3. The test will be done similar to a cardiac angiogram. 4. The test will be completed in about 5 minutes. The correct answer is 2. Radiopaque dye will be injected between the toes. Dye is injected between the toes of both feet, and then scans are performed in a few hours, at 24 hours, and then possibly once a day for several days. In option 1, the scan detects abnormalities in the lymphatic system, not the vascular system. Cardiac angiograms are performed through the femoral or brachial arteries and are completed in one session. The test takes 30 minutes to 1 hour and then is repeated at intervals. Options 1 and 3 could be eliminated because of the words vascular and cardiac. These words pertain to the cardiovascular system, not the lymphatic system. The nurse is completing a care plan for a client diagnosed with leukemia. Which independent problem should be addressed? 1. Infection. 2. Anemia. 3. Nutrition. 4. Grieving. The correct answer is 4. Grieving. Grieving is an independent problem, and the nurse can assess and treat this problem with or without collaboration. Treating infections, which require HCP orders for cultures and antibiotics, is a collaborative problem. The treatment of anemia is a collaborative problem. The provision of adequate nutrition requires collaboration between the nurse, HCP, and dietitian. The stem of the question asks for an independent intervention. If you understand the problem and the treatment needs, options 1, 2, and 3 can be eliminated. The nurse writes a nursing problem of altered nutrition for a client diagnosed with leukemia who has received a treatment regimen of chemotherapy and radiation. Which nursing intervention should be implemented? 1. Administer an antidiarrheal medication prior to meals. 2. Monitor the client's serum albumin levels. 3. Assess for signs and symptoms of infection. 4. Provide skincare to irradiated areas. The correct answer is 2. Monitor the client's serum albumin levels. Serum albumin is a measure of the protein content in the blood that is derived from the foods eaten. Albumin monitors nutritional status. The nurse should administer an antiemetic prior to meals, not an antidiarrheal medication. Assessment of the nutritional status is indicated for this problem, not assessment of the signs and symptoms of infections. This addresses an altered skin integrity problem. Which medication is contraindicated for a client diagnosed with leukemia? 1. Bactrim, a sulfa antibiotic. 2. Morphine, a narcotic analgesic. 3. Epigen, a biologic response modifier. 4. Gleevec, a genetic blocking agent. The correct answer is 3. Epigen, a biologic response modifier. Epigen is a biologic response modifier that stimulates the bone marrow to produce red blood cells. The bone marrow is the area of malignancy in leukemia. Stimulating the bone marrow would be generally ineffective for the desired results and would have the potential to stimulate malignant growth. Because of the ineffective or non-existent WBC's characteristic of leukemia, the body cannot fight infections, and antibiotics are given to treat infections. Leukemic infiltrations into the organs or the central nervous system cause pain. Morphine is the drug of choice for most clients with cancer. Gleevec is a drug that specifically works in leukemic cells to block the expression of the BCR-ABL protein, preventing the cells from growing and dividing. If you were not familiar with the drug mentioned in option 4, then this option would not be a good choice. Options 1 and 2 are common drugs and should not be chosen as the answer unless you know for sure they are contraindicated. The client is diagnosed with chronic lymphocytic leukemia after routine laboratory tests during a yearly physical. Which is the scientific rationale for the random nature of discovering the illness? 1. CCL is not serious, and clients die from other causes first. 2. There are no symptoms with this form of leukemia. 3. This is a childhood illness and is self-limiting. 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. The correct answer is 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. In this form of leukemia, the cells seem to escape apoptosis, which results in many thousands of mature cells clogging the body. Because the cells are mature, the client may be asymptomatic in the early stages. All types of leukemia are serious and can cause death. The chronic types of leukemia are more insidious in the onset of symptoms and can have a slower progression of the disease. Chronic types of leukemia are more common in the adult population. The symptoms may have a slower onset, but anemia causing fatigue and weakness and thrombocytopenia causing bleeding can be present. Organ enlargement from infiltration may be present. Secondary symptoms of fever, night sweats, and weight loss may also be present. The client diagnosed with leukemia has central nervous system involvement. Which instruction should the nurse teach? 1. Sleep with the head of the bed elevated to prevent increased intracranial pressure. 2. Take analgesic medication for pain only when the pain becomes severe. 3. Explain radiation therapy to the head may result in permanent hair loss. 4. Discuss end-of-life decisions prior to cognitive deterioration. The correct answer is 3. Explain radiation therapy to the head may result in permanent hair loss. Radiation therapy to the head and scalp area is the treatment of choice for central nervous system involvement of any cancer. Radiation therapy has longer-lasting side effects than chemotherapy. If the radiation therapy destroys the hair follicles, the hair will not grow back. Sleeping with the head of the bed elevated might relieve some intracranial pressure, but it will not prevent increased intracranial pressure from occurring. Analgesic medications for clients with cancer are given on a scheduled basis with a fast-acting analgesic administered PRN for breakthrough pain. Cognitive deterioration does not usually occur. You must be aware of the treatments used for the disease processes to answer this question, but might eliminate option 2 because it violates basic principles of pain management. The nurse is caring for clients in an oncology unit. Which neutropenia precautions should be implemented? 1. Hold all venipuncture sites for at least 5 minutes. 2. Limit fresh fruits and flowers. 3. Place all clients in reverse isolation. 4. Have the clients use a soft bristle toothbrush. The correct answer is 2. Limit fresh fruits and flowers. Fresh fruits and flowers may carry bacteria or insects on the skin of the fruit or dirt on the flowers and leaves, so they are restricted around clients with low white blood cell counts. Option 1 would be done for thrombocytopenia, not neutropenia. Clients with severe neutropenia may be placed in reverse isolation, but not all clients with neutropenia will be placed in reverse isolation. Clients are at a greater risk for infecting themselves from endogenous fungi and bacteria than from being exposed to non-infectious individuals. Option 4 is an intervention for thrombocytopenia. Option 3 has the word all in it, which would make you not select this option. Which are the most serious complications for a child with Kawasaki disease? Select all that apply. 1. Coronary thrombosis. 2. Coronary stenosis. 3. Coronary artery aneurysm. 4. Hypocoagulability. 5. Decreased sedimentation rate. 6. Hypoplastic left heart syndrome. The correct answers are 1. Coronary thrombosis, 2. Coronary stenosis, and 3. Coronary artery aneurysm. Thrombosis, stenosis, and aneurysm affect blood vessels. The child with Kawasaki disease has hypercoagulability and an increased sedimentation rate due to inflammation. Hypoplastic left heart syndrome is a congenital heart defect and has no relation to Kawasaki disease. On examination, a nurse hears a murmur at the left sternal border in a child with diarrhea and fever. The parent asks why the healthcare provider never said anything about the murmur. The nurse explains. 1. The healthcare provider is not a cardiologist. 2. Murmurs are difficult to detect, especially in children. 3. The fever increased the intensity of the murmur. 4. We need to refer the child to an interventional cardiologist. The correct answer is 3. The fever increased the intensity of the murmur. The increased CO of the fever increases the intensity of the murmur, making it easier to hear. Option 1 is not a therapeutic response. This child does not need to see an interventional cardiologist. The murmur needs to be diagnosed first, and then a treatment plan would be developed. Indomethacin may be given to close which congenital heart defect in newborns? Blank. The correct answer is patent ductus arteriosus. Prostaglandins allow the duct to remain open. Thus, a prostaglandin inhibitor, such as indomethacin or ibuprofen, can help close the duct. The nurse is caring for a child who has undergone a cardiac catheterization. During recovery, the nurse notices the dressing is saturated with bright red blood. The nurse's first action is to 1. Call the interventional cardiologist. 2. Notify the cardiac catheterization laboratory that the child will be returning. 3. Apply a bulky pressure dressing over the present dressing. 4. Apply direct pressure 1 inch above the puncture site. The correct answer is 4. Apply direct pressure 1 inch above the puncture site. Applying direct pressure 1 inch above the puncture site will localize pressure over the vessel site. Options 1 and 2 are not appropriate actions. Option 3 can be done after applying direct pressure 1 inch above the puncture site. Which statement by a parent of an infant with congestive heart failure who is being sent home on digoxin indicates the need for further education? 1. I will give the medication at regular 12-hour intervals. 2. If he vomits, I will not give a makeup dose. 3. If I miss a dose, I will not give an extra dose. 4. I will mix the digoxin in some formula to make it taste better. The correct answer is 4. I will mix the digoxin in some formula to make it taste better. If the medication is mixed in his formula and he refuses to drink the entire amount, the dose will be inadequate. Options 1, 2, and 3 are appropriate for digoxin administration. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observes that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is blank. The correct answer is rheumatic fever. To make the diagnosis of rheumatic fever, major and minor criteria are used. Major criteria include carditis, subcutaneous nodules, erythema marginatum, chorea, and arthritis. Minor criteria include fever and previous history of rheumatic fever. Rheumatic fever is an inflammatory disease caused by group A beta hemolytic streptococcus. A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as blank. The correct answer is patent ductus arteriosus. This is a defect with increased pulmonary flow. It should close in the first few weeks of life.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.